All right. Thank you so much. This is such an honor to be able to be invited to speak today and just to have the opportunity to reach out to so many people through these means. So thank you so much, Catherine, for inviting me and getting this together today. And thank you all for taking time out of your day to jump on. And I look forward to meeting more in person. So it's kind of what I'm talking about today. So thanks so much. Just real brief, I will tell you a little bit about Sugar and Spice. So I'm a nurse. I started this company about 4.5 years ago. My experience is in the emergency room in the ICU at Flagstaff Medical Center. Before that, I was a dispatcher for Guardian and a 911 dispatcher for the Flag PD. My husband's a firefighter, paramedic. We have been in Flagstaff for about 26 years, raised our 4 kids here, and we've got 5 grandbabies and 1 on the way. So Flagstaff is deep in our roots now. Can you guys hear me okay? Yeah, okay. All right, awesome. So a little bit about Sugar and Spice. We're a caregiving company, but because I'm the owner, I actually have medical oversight over all of our clients. So that is a huge difference that separates us from a lot of the other caregiving companies that are out there and across the country, is that they are rarely overseen by any kind of medical oversight. So what's been really cool is just the level of care that we've been able to provide to our clients. We've been able to catch infections early. We've been able to keep them out of the hospital. We've been able to work very closely with hospice, with their nurses and the medical needs of the clients. I can go to the home and draw blood. I can repair a skin tear. I can teach all of our staff how to give medications through a peg tube. There's just a lot of different things. We just finished up with a client with a wound vac. So we can take some of those higher level needs and have that medical component to it. So that's really fun for us. Let's see. Other than that, I think that we are pretty similar to other caregiving companies. We are covering Sedona now and Williams, and of course everything in between. So Munns Park and the Parks area and Belmont, and we have not expanded to Winslow. I've had several requests to go that direction. We've not headed that far out yet in that direction. But if you guys have any questions, maybe I can figure out how to open the chat.
That's okay. If something comes up in the chat, I'll just let you know.
Okay, awesome. Thank you.
Yeah.
Okay, so that is us. And I just wanted to start with just some really brief, boring facts about COVID and where we're at today. I'm really not a huge, I have not been keeping up on all the statistics every day and all that kind of stuff. I just, but I thought it would be helpful for us for today. So as of yesterday, 39% of residents in Coconino County have been vaccinated. And then if you want to put up this outline, Catherine, you're welcome to. And then the level has been downgraded to substantial from moderate. Only 9 cases that are currently in Coconino County are for people age 65 and over. So that's amazing. Really low numbers. Only 3 people with COVID positive are currently in the hospital. 3. As of yesterday, there's only 19 total cases in Coconino County. There are 0 deaths this week, and that's actually been the case for about the last 3 to 4 weeks. I think there's been 0 or 1 death in Coconino County. And then, schools are back in session and the state mandate for masks has been lifted. And so we're headed in the right direction. One of the things, oh, cool, thank you. So if you, scroll down a little bit. Oh, where is it? Oh, there we go. Oh, it came up all weird on the screen. Okay, well, that's all right. So I was going to talk about this acronym. So you got COVID spelled down the left side. And then I came up with this morning, and it's critical overload, violent isolation dump. And I just wanted to talk a little bit about what our experiences have been and what my personal experiences have been with COVID and how it's affected so many of our clients, and then some of the residents that are in my dad's facility. So just so you guys know too, I started this company, and then about 6 months after that, my dad was diagnosed with Alzheimer's. So I am on both sides. I'm living it with my family, my own parents, but then we're also, working with a lot of clients who have Alzheimer's and dementia and different kinds of physical problems. So I feel like I do have a really good idea on what the challenges are that a lot of our families are facing through this COVID season. So what I mean by critical overload, violent isolation dump. So I think if we don't really recognize what has happened over the last year and a half, our solutions are not going to be effective. So I just wanted to talk a little bit about what we've seen. So critical overload, what I mean by that is that it's just been an out of the blue massive tsunami that has hit the world, right? All of you guys have been living this too, but I'm thinking about our families who are those middle people. They've got elderly parents, and then they've got the sandwich generation, right? So you've got families that are used to going to work, running their kids around. Now suddenly grandma needs a ton of help, and they're suddenly tasked with, well, she can't leave. We don't want caregivers coming in because we don't want to risk anybody bringing COVID in. There's all these new challenges that erupted, and it has really hit all of us very, very hard. I wanted to give you a definition of violence, and this actually really shocked me when I kind of had it in my head, but then when I read the definition, I was like, wow. So think about COVID when I read this. So it's the intentional use of physical force or power, threatened or actual, against oneself, another person, or against a group or community that either results in or has a high likelihood of resulting in injury, death, psychological harm, maldevelopment, or deprivation. So if you think about COVID and then you think about that definition, it's pretty darn close in how it has affected a lot of our people in our community. If you just think about the isolation piece of this, it's crazy. And I was calling around. So in the process of my dad's journey with Alzheimer's, so back in September, he really just reached a breaking point. We'd been managing him at home. We'd been having caregivers come in, but he and his Alzheimer's journey just became a way too much of a handful. I think we had some medication, bad medication mixes going on with him that we were trying out. But anyway, he became violent with mom. He became very threatening and intimidating. So he had to be removed from the house. We went through this process of, first he went to the ER, and then he was transferred down to a geriatric psych unit in Prescott. They were awesome. He was there for a couple weeks. And then through a lot of research, mom and I decided that at his level, he would probably best fit into a facility that had like a neighborhood design. So he's down in Scottsdale right now. But in the process of calling all these different facilities and asking them, I mean, one of our most important requests was, can we visit him? You can't take a man who's been driving a month ago, and 6 months before that, he was out cutting a load of wood, and then stick him in a little room where that would have just been absolutely torture for him. So I remember calling a facility, and this woman was really, really proud of herself. She was like, we have done such an amazing job. We have all of our residents, they've been in their rooms for the last 6 months. We bring them their meals. We've kept them completely safe in their rooms, all their individual rooms. No one has been with each other, and we've had 0 cases of COVID. And she was really proud. And I said, wait a second, are you telling me that your residents haven't been allowed out of their rooms in 6 months? She's like, well, yes. And I'm like, well, and then she says, but we're starting to open the doors, and we're starting to let them come out of their rooms one at a time and stand in the hallway. And then there's a little interaction with our activities director. And I'm like, I didn't know what to say. I was like, that's absolutely the worst treatment I can imagine. Like, that's what we do. Isolation or solitary confinement. That's what we do to people in prisons. It's like one of the highest level of imprisonment is solitary confinement. And I'm just picturing this, all these sweet little people in their rooms, just no interaction, no neurological interaction, no sensory interaction, no nothing. And I'm thinking, okay, what I know about our senior population, and when they get like when they're in the hospital, you have somebody it has to be hospitalized. One day for an elderly person in the hospital is like 5 or 6 days for a younger person. So I put that little fun fact a few parts ways down on the page. But so, like, if you think about an elderly person that has a fall and they end up in the hospital for a week, that's like a month and plus some days for recovery. It's like that's the equivalent of how long it takes them to recover and how quickly they lose muscle and coordination. So I was just picturing that same equation into cognition for these poor folks who have just been through so much isolation during this process. We have another client, their family called and said, so the daughter, who has a lot of chronic health problems, is caring for mom. The daughter has kind of gotten in the car and left a few times to get groceries, and things have been brought in, but the mom the mom has not left her house in over a year. And I don't think that's that rare. I think that's like one of the things that we're seeing as people start emerging and coming out and talking. We're going to hear about that. Like, yeah, I didn't leave my house for a year. And so what kind of things are developing in our psyche from not being outside for that long, having very little human interaction, having very little, especially for our seniors, like just all they have is the TV and just all of that it's feeding in, and the news and the threats and the, all the worst case scenarios that people have been hearing over the months. Another thing I wanted to show you about this solitary confinement, this is just something that, so definition, it's a form of imprisonment distinguished by living in single cells with little or no meaningful contact with others. And then there's this project called the Marshall Project. I think it was several years back, but there was a guy who was in solitary confinement. And I understand this is like way exaggerated. I think he was in there for years, like 5 years. But they said that this is his, one of his stories. He says, when they came to my cell, I could hardly speak. In my head, I know the words that I was saying. I thought I was speaking them, but they weren't coming out. They were garbled because I hadn't talked to anyone for so long. My vocal cords were weak. And so you think about how our seniors have been affected by this. I think we're going to see a lot of language loss. I think we're going to see muscle strength and coordination loss. Just from lack of activity. I think there's a social paranoia that has developed in a lot of our seniors. I've seen that too. We've got a resident who, his wife is battling cancer, and she's the caregiver for the client. The client had a brain tumor several years ago and has been left with you know, short-term memory loss and balance problems and things like that. Well, because of COVID, you know, they just hunkered down. And so same thing, he has barely been out of his house for a year. She said now he has this social anxiety about leaving. He will barely even walk to the mailbox. He gets really winded when he does. He falls frequently because he's so weak, because all he's done is walk from the couch to the bathroom, to the kitchen, to the couch. Um, and he really becomes very anxious if he's out of the house for more than an hour. He becomes very, very anxious and has to just like get back home. So I'm just kind of going through these to kind of highlight some of the challenges and some of the issues that I'm seeing personally in our own with our clients. Trust issues, I think this is huge too. I think that we've all developed this issue where we just don't trust anybody, where we go to the grocery store and we're looking at people through this filter of like, was that a cough? Did you sneeze? You know, do you look clean? Did you take a shower today? And we kind of have this whole thing that we do with each other now where we're just afraid to touch each other or be close to each other. And then lack of knowledge. I think that people just, you know, again, back to the way that TV and the news deliver information, I think it's really lopsided sometimes, and it's not the truth about how bad or how not bad something actually is. Depression, discouragement, frustration, frustration over just not being able to get out, not being able to do things that they used to do. You can't go golf, you can't, you know, all these can't do's now. And it's just frustrating to be at home. And then on Zoom calls, I wanted to say, I mean, it's not all bad, right? Like there has been some great things that have developed because of COVID. We have learned how to connect in ways that we didn't think were going to be possible. But I did want to talk about Zoom because some of the problems that I've seen with that go back again to watching our clients try to do a Zoom call with a doctor. And it's it's not that great of a solution because you have a population that's not really techie savvy. You have maybe they don't even own a computer, or the computer doesn't have a camera because it's so old. So then they're trying to use a phone, but then they have a flip phone. And so, you know, there's been all these issues. I know that with us trying to do Zoom calls with Dad when he was in the facility, he so another little speed bump in his journey. He did get COVID in the facility. We almost lost him. He did survive, but in the process, he declined a lot. So he lost his language. He lost his balance. He became incontinent. He developed an impaction. He got a urinary tract infection. He fell. So, you know, all this has happened in the process, but one of the things that we realized is that Zoom calls worked okay before he got COVID, but then afterwards, with all the advancements of his disease, it was like he couldn't focus on a computer screen. We're like, "Hi, Dad, how you doing?" And we're watching him, and he's like not looking at the screen. He's looking around the room, trying to figure out where the voices are coming from. He knows they sound familiar, but you know, he can't place it. He's standing up and walking around. He doesn't understand that he needs to, you know, talk close to the computer. He's leaned back like this. Now we can't hear him. And there's just, you know, it was such a problem. I know even before my dad went into the hospital, Mom kept trying to do Zoom calls with the doctors, and she couldn't get her phone to work. She would just get so frustrated. She would be in the waiting room for like an hour, and she would text me and say, you know, what's going on? I'm like, oh my goodness, I think you should probably hang up and call the office if you've been sitting in the Zoom waiting room for an hour. So there's just this, you know, it's just not a beautiful solution. And so what I wanted to say is that I gave you all my little examples. I think I did. Oh, I want to tell you about one other guy. So the 78-year-old male that I have listed here. This is interesting because so our caregivers go in and take care of this husband and wife duo. And they've been moved in with their son and daughter. So the son and daughter work every day. So they've asked us to come in and sit with grandma and grandpa and provide meals and medication reminders and clean the home and help them with showers and all that kind of stuff. Well, over some time, the husband, who really isn't the one that needs the help, it's more the wife, but the grandpa, he started having all these like aches and pains, and he would sit on the couch and he would just be doubled over in pain. And you would ask him, where's your pain? And he would point to his shoulder. And so then the family took him to the doctor for the shoulder. Well, they can't find, x-rays, everything looks okay. He seems to have full range of movement. There's, we can't really pinpoint anything. Well, then he would be hurting somewhere else the next day. And then the next day he'd be, something else would be wrong. And he just wanted to sleep all the time and became very irritable and edgy with his wife. And so I was talking with the daughter, and she was describing how they're becoming very frustrated because they can't figure out what's wrong with him. All his blood work comes back fine, and he seems to not be able to tell them what the problem just keeps changing. It's a different ache or pain each day. And I thought, I wonder if he's just really struggling. Okay, so you think about it, this poor husband and wife, or the grandma and grandpa, they were moved in, they left their home in Taos, they've been brought to live with the son and daughter. He no longer feels like he has purpose. He's not doing anything around the house. He's not with his friends anymore. He's in a totally different environment. He doesn't feel like he has a role in this family other than just kind of to be a burden on them. So we did an ice cream experiment. So what I mean by that is I told the caregiver, I said, let's do something fun. Get him in the car, take him out, go wherever he would like to go, get him some ice cream, go to a restaurant, pick out his favorite restaurant and go there. And so the granddaughter was home. We left the grandmother with the granddaughter, and we just took the grandpa out. And it was amazing. He didn't complain about pain one time. He started talking about stories of where they're from and what he used to do. And he was laughing and he had a great time. And they came home and he didn't have a single problem walking into the house. And I'm like, wow, there is a huge psychological component to people being stuck at home. So at what point do we look at the risks associated with getting COVID versus all the other problems that are coming up from people being stuck at home? So my challenges are the next page says, that sucks. Now what's the solution? So I think we need to lead by example, right? The trends are going down. The cases are dropping sharply. It's like, can we start to breathe? Can we really self-evaluate and figure out, how do I feel about this? Do I feel safe going out? Because we can't really be, hypocritical either and say, and I'm talking to myself right now because I'm thinking, oh my gosh, I put on my notes, can we take our masks off and can we shake hands again? But then I look at, like, our policies haven't changed. All of my caregivers are still checking their temperatures and wearing their masks and all that. So I put it on here with question marks because I'm thinking, can we just please start to think about it? Can we start to think about getting back to normal? And I really feel like we need to lead by example in this. And by that, I mean, if we don't start doing human interaction again, person to person, open up our office doors, start to hold your support groups in person with the option to join by phone. What can we do to show people that it's okay to move forward? It's okay to come out of your house. I think that as trusted medical professionals, a lot of our community is watching us to see how are they going to react? When are they going to start to open up? When are they going to start to get back to normal? And it's almost like people need permission to be able to open their doors and to be able to come out again. And I think, you know, if you think about the last year and a half, all people have heard is don't do this, don't do that, don't leave your house, you know, don't take the risk, don't, you know, all these things. And I'm not against that. I think that it helped a lot, don't get me wrong. But I think now it's time to just start some movement, start to open up, start to meet with people in person. And let's educate our seniors about the vaccine. So one other thing that came up was in one of our, she's a fairly new client with us. She has lung cancer. She got the first vaccine, but she got really, 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 really sick with it, got put in the hospital. How am I doing on time? And she was, so they told her, you cannot get the second vaccine. It is not safe for you. So when caregivers started coming into her home, she was very adamant that everybody have the vaccine if they're going to come into her house. So that brought up a whole different kind of challenge for me as to, well, it's really, it's not okay for me to demand my staff to get the vaccine. It's got to be a personal decision. It's also not okay for her to know their medical history or their choices. So how do I get through this? And I decided that maybe education would be the best way to help bring her some peace of mind. So I called her and I said, you know what, I totally understand your concerns, especially with you having lung cancer, not able to get that second vaccine. So you feel like you can't completely protect yourself like you want to. But I just need you to understand something. The vaccine is going to help you if you get COVID to not suffer as much consequence, or not consequence, but suffer as many symptoms as maybe you would have if you didn't have the vaccine. It is not going to protect you from someone bringing the vaccine in, or the virus into your home, right? So it's just like with any other flu vaccine or whatever, we can still go to the grocery store and get a virus on our hands and bring it wherever we're going. Just because I have the vaccine, it might mean that I won't develop the symptoms, but does that make sense? It's not going to change the transmission of viruses and bacteria and things like that around our world. So basically what I was trying to explain to her is that even if all the caregivers got vaccinated, it still doesn't mean that they couldn't bring something into your home. Now, if they got the virus and they had the vaccine and they didn't develop as much symptoms, so they weren't coughing and sneezing and their nose wasn't running as much, then yeah, they're going to be less likely to transmit a virus. But I think that really, she's like, oh, I thought it meant that they couldn't get the virus at all. I'm like, no, actually, it doesn't mean that. It just means that it's going to relieve you of some of the symptoms and you'll get over it faster. So anyway, that really helped her. And so I'm just thinking that if we can educate our people and empower them again so that they know, okay, hand washing, I'm gonna, I got my vaccine or I chose not to or whatever. I'm gonna wear my mask. I'm gonna wash my hands and I'm gonna be safe. And it's okay for me to leave my house. And so I have a little, let's see, my closing statement. So I was thinking about, I had this picture in my mind of like Hiroshima, like what it must have looked like after that bomb detonated and all the dust settled and everything was just like this crazy desolate land. And so the bomb is detonated, the dust is settled, the sun is shining, the plants are emerging from the ground. It's time to come out of hiding and open the storm door. Let's rebuild this community because we need each other. The end. Any questions?
Well, thanks a lot, Regina. I appreciate you opening that dialogue. I think that's a great spot to wrap, the formal presentation part of it, and then encourage folks to say, how are we going to address some of that language deficit, that isolation, that lockdown deficit that people are emerging with, and how will we be rebuilding? So yes, please, if people have questions, comments, things to contribute, by all means.
Hi, Regina. We spoke yesterday.
Oh, hi.
I think your
Angela.
Yeah, hi. I think your presentation enlightened me. With the population that we deal with, my mother was 93 and she stayed also in her home for over a year because of COVID. And she was mobile, but I never really thought about the physical decline and the impact that COVID would have on someone that does have cognitive issues. Until I heard you, present it. I mean, I'm sure like it was always in the background of my mind, but I never really thought about how COVID, just staying home, has probably really caused some of our seniors to decline emotionally, mentally, physically, overall.
Right.
So I like the example that you gave about the gentleman having a multitude of, physical issues and just despair, and then just getting him out changed him totally.
Yeah, well, thank you so much. I appreciate that feedback. I want to say too that I didn't mean to put like shame on anyone for trying to do the right thing. So if if you have a mother or father or senior in your family and you said, no, you can't come to the birthday party this year, or no, you can't be around family, or we're not going to have those dinners. We're just gonna talk on the phone and that's it. Like, I get it. I think we all get it. I think we all understand that level of love. It was based in love. It was based in concern for that person that you're trying to protect, and you're doing everything that you're told to do, right? And I think that it's just, now that the dust has settled, we're looking back and saying, wow, maybe we could have done something with a little more balance, but now what? Okay, so that happened. That's what we did. A lot of people went through this, but now what? How do we fix it now? And so I think that it's just important that we do start to give those people permission, give your family permission to start coming out, and to, start small. Maybe being out of the house for an hour is going to cause a lot of anxiety. And don't be surprised if you start to see that, where they're like, whoa, I don't know what's wrong. I just feel really anxious. I think I've been out to, I'm tired, whatever excuse they might give. Just go ahead and honor that, and just reaffirm how wonderful it was to spend some time with them, even if it's 30 minutes, or maybe you go to a coffee shop, but you go in and get 2 coffees and bring them back out and just sit in the car. Start small and just let people slowly build that trust and see that the sky's not falling anymore.
Have you seen kind of a change? So I was just, when you were talking about this, thinking of one of my friends whose father has dementia, and during the whole COVID, the family actually removed a lot of the caregiver support that they had of people coming and just took the burden on themselves so they could keep their small cohort. This is, of course, before the vaccines rolled out. So had you guys really seen some of the similar progression of family really bearing the burden of their loved ones and taking this on and doing it themselves? And now how are you reapproaching reintegration?
Right. Yeah, absolutely. I think I've seen it across the whole spectrum. Even young moms who now have all their kids at home and they're trying to homeschool and keep the other 2 from screaming through the Zoom, in the background. And then the full spectrum from families, yes, trying to juggle work, trying to juggle, getting 2 households taken care of now, and getting groceries and cleaning grandma's house, and or do we move her in? No, that's too risky, you know, but then that just constant heaviness of, are they okay? And now nobody's laying eyes on them anymore because we pulled the caregivers out. And it's just, yes, I mean, it's been such a weary season for so many families, that are, and there's so much guilt too. It's a crazy thing where you feel this responsibility to fully take on everything. You know, you got to take on grandma and grandpa, but you still got to work, but you still got your own kids. And yeah, I think that's very, very real. And then what we risk is that, you know, that tension building, and then that sometimes people start yelling at each other, and they just get super frustrated because everyone's on edge, and the dynamics of that son father relationship changes, because now son can't just be son. Son's got to clean the house and run the vacuum and get the groceries, and, you know, God forbid, help dad shower or help mom shower. I mean, we've seen that too, where the sons are trying to help their
And
mom.
Regina, can I interrupt just real quick? Are you seeing then resistance to reintroducing the caregiver with this emerging, you know, trying to come out of quarantine, that as those folks are having to go back to work, as their kids are going back to school, are these folks who've been taken care of by son, even though they're fighting, are they allowing caregivers back in the home, or are they now saying, well, you've been taking care of me this whole time, why can't you just keep doing it?
Both. Sometimes the parents are resistant to having somebody come back in because they're like, well, this is, you know, you should be able to do this, you're my child. And not having any concept of how much of a burden that child might be carrying in their real world, and then not their real world, but, you know, with their life and their family and their jobs and their careers and everything. But yes, we are starting to see people open up to the idea a little bit more. I think the challenges are, well, have all your caregivers had vaccines, and have all your, you know, who's had COVID, and what kind of things do you have in place? And so that's where it does bring them some peace of mind to educate them about the vaccine. And then, yes, we do have things in place, like they have to check their temperature before they start work, and they are wearing masks, and they are disinfecting surfaces in your home throughout their shift, and door handles and things like that. So we have come up with solutions to try to combat that, meet people where they are. But then I also just want us to slowly start thinking about releasing some of that grip. Did that answer your question?
Absolutely. Yeah. Thank you.
You're
Yeah.
welcome.
Other thoughts or questions or feedback, experience maybe that other people have had from their own agencies with watching folks trying to enter back into whatever new life looks like?
I have another random question, but how are you guys managing telehealth with the older adult population? Because it's likely sticking around. Now, I know regulation, when it first released, you know, there was a lot of flexibility. You could do a phone, you didn't have to do audio visual, you could just do audio. And CMS seems to be kind of cracking down or putting some guidelines and rules around that. So are the private payers, that you really have to have an approved HIPAA compliant system. It has to be something like Zoom or one of the other programs. How are older adults kind of integrating that, knowing that this is going to likely continue? Primary care offices are going to continue to have this type of service.
Yeah, so I think it is going to be a slow moving process. I guess my hope is that physicians are going to start to, I don't know, it's been mind boggling to me how many Zoom calls have happened, given some of the illnesses that people have been weathering at home. I know as a nurse, and probably all of you know this too, like, you do a crazy amount of assessment in the first 30 seconds of being in the room with someone. you pick up on so many things about how they're doing, and how we've been able to make it this far on Zoom and telephone calls is really, it scares the crap out of me, because I think that we're missing so many things. And so I'm hoping that physicians will want that for their own, for their own standard, that they're going to want that ability to do that assessment in person again. And but then, they're probably going to feel resistance from their patients as well, because their patients are going to think, well, why do I have to get up and get dressed and get in the car, and that takes 3 hours for me just to do that? So why can't we do it by phone? So I think it's going to be an option still. I hope for some people it is an option, because for some it's a really great option. But I do hope that offices do start to open their doors and schedule in-person appointments, and give people that option to, do you want to come into the office, and let them make that decision? Because I think there's a lot of people out there that feel like they're not getting the care that or they're not being able to get their point across, and they're not being able to explain themselves appropriately through a phone or a computer screen. So that's my hope. And I think if we all start to do it first, then it'll lift in our community as well.
Well, Tiffany, I know you didn't especially ask me, and I appreciate, Regina, you saying what you just said, but I'm going to share what our office has been doing, because I hope we're doing some role modeling in that area, but I think it's a big hybrid of, we have still providers who want to be at home, and we also have providers who are sick some days, and it seems like we have a telehealth system. If I'm sick, why would I come into the office? Even if I don't have COVID, I'm like blowing my nose or coughing, but I can, have a hot drink and still have a session online and be functional. Obviously not if they're puking, but there's that window of, I'm sick enough, I don't want to expose other people, but I'm not so sick that I couldn't still work. And pre-COVID, we would have all just gone to work anyway,
Mm-hmm.
So we have folks who are coming in and using like a office staff person, one of our bachelor's interns actually, who sets up the tech in a room, and they sit down on the couch and they have their session with their provider in the same room they would normally have their session with their provider. But instead, their provider is on the screen, sitting on the chair across from them, rather than physically, literally sitting across from them. And then that tech support, essentially, person checks on them, at the halfway mark to make sure everything's fine. And they also know where that person is sitting outside the room if they need to come out and say, the system crashed, or I don't know what to do. And all of our gerontology clients have taken advantage of that, actually, even through COVID, when our office was mostly closed. The folks who were stuck at home and really couldn't negotiate technology, hearing deficits, visual deficits, all kinds of things that made tech difficult, they came in and had a tech support person that just set them up in a room. And we've been able to continue that on. I don't know that everybody can do that, but that hybrid model has worked really well for us.
Yeah, I think that's amazing. And I love the creativity of people thinking outside the box and coming up with solutions for people like that, who maybe they don't even have a computer at home, but they still want to keep their appointment. Otherwise, they're going to have to wait for months and months and months. I think I would like to just tell a little short story about something that happened with my dad. And so we were doing a window visit through his facility in Scottsdale. And, he had on this straw hat. And I'm like, oh, that's cute, because you used to be a farmer, that you look really cool in that. But he's never worn a straw hat in his life. And turns out, the activities director had done some cool activity, and they were all wearing straw hats and playing music. And I was like, Daddy, you look so great. It's so great to see you, even though it's through this window and we're both talking on phones. But he took his hat off and he had this huge abrasion right here. And so then we're like, oh, Dad, what happened? So apparently he had fallen. Nobody knew when, nobody knew how, but he had this big old abrasion on his head underneath his hat. And I'm just thinking, there's got to be instances like that we're missing stuff. We're just missing stuff. And I really hope that we can get back to just be in the same room, pick up all those nonverbal cues, understand where people are really at, and just get back to doing life with that level and that standard of care that we used to have. Maybe we always have Zoom, maybe we always have telehealth now, maybe it's more available and it serves an amazing option in certain circumstances. I'm not saying it doesn't. I don't think it should go away, but I think that we should try and just do more of getting back to life as normal.
Regina, thank you. My name is Autumn, and I'm the Director of Spiritual Care at the Peaks. And first, I just want to say how much I have seen what you were talking about, where the isolation has really just the degree of the effect has been huge. And we've been able to open up our activities in the past month. And one of the things that surprised us a little bit was seeing that there's not a great deal of participation. And so as we started to see this, it suddenly, with a couple weeks out of opening up, it makes more sense that it's, I had thought, okay, wow, we're open. It's going to maybe even be a flood of interest. And so one of the things that we're doing here is for the residents who are interested and joining and participating is we're actually having them reach out to other residents. And then initially as well, what we were doing is going and inviting resident, knocking on their door and trying to get them to come to the activity. But what we're finding is that the more that we have asked the resident, can you help us bring people to this activity we knew you enjoyed before? Just how much that sense of empowerment, and I feel like I was relating to that a lot as you were talking about it, that sense of the residents feeling empowered to start taking the action themselves. And so I don't necessarily have another question besides any suggestions or experiences you've had in terms of like just knowing there's going to be that slow to get back to things because it's been so quiet and depressing.
Yeah, well, first of all, can I just say that I'm so excited that there even is a spiritual care director position. I think that is so amazing. I love that. And then I guess what I was picturing when you were talking was what kind of activities you were doing. I'm wondering, are you doing a lot with music?
Yes, there is some music coming back, which is really great.
Yeah, and I love the idea that you're using some of those that have braved coming out to try to encourage the other ones. I think that peer voice is probably really powerful and so great. So that's an awesome idea. And then my other suggestion would be, what if, I'm assuming you probably have the activity room and you do a lot of your things in activity room. Is that right? Okay, so could you potentially take the people that are participating and set up some chairs down the hallway and turn on the music a little bit louder than normal? And what if you went into each of the rooms and you gave everybody in their room an instrument, like a maraca or a drum, or I don't know, can you run some, make the music go to them and make the activity and that fun be just outside their room. Maybe they'll get to the point where they'll sit their chair in their room, but at least they'll be facing the hallway. What if there was movement in the hallway? What if the residents were marching up and down with their tambourine in the hall and the music was blasting and it was just what could you get it to them more?
Yeah, thank you. I love that suggestion. And it sounds fun too, which I think is so needed, that aspect of fun.
Yes, we need to be real and have fun. And before COVID, I mean, when I would sit down with people, I'm like, okay, what do you like to do? What are your favorite movies? Let's go to a movie. Let's go to a play at NAU. Let's go to a park. Let's go for a drive. Where do you want to go? Let's go fishing. As many people as we can. We try to get them back into doing real life activities. And a lot of folks have just given up on that stuff because they don't drive anymore. They know they would probably roll down the hill and end up in the lake if they went by themselves. But what can we do now that you have somebody with you that can drive and that can let's go get a fishing license, let's go whatever, and let's go do something fun, and try to just pull them out of their shell and get back to life.
Well, and it sounds like you're talking too about that component earlier of incremental exposure. Instead of, I think a lot of us were expecting, oh, everyone will flood, but no, people are still really nervous and scared and have a hard time figuring out how to interact with each other, still sit silently, even when they're surrounded by folks that they know really well. And like, I love that idea, that thought of having something come to them. They could still be in their room. They don't even have to be out in the hallway, in their safe zone, and slowly but surely, incrementally inch their way out. Sounds really nice. Yeah.
Yeah, I think that we need to do that, and it's totally understandable how people have developed this. And the guy on that Marshall project, I was reading more of his story, and he was talking about how after being in that isolation in the what is it, the confinement, that he was so scared. He was terrified to even go to the shower. He was terrified to leave his room. The guards would actually use that anxiety that he has against him. So whenever they were upset with him, they would say, we're going to pull you out of your cell. We're going to make you come out here. We're going to put you in the middle of the yard. And he would freak out. And so if you think about that on the scale of like what our seniors have gone through, they've really inadvertently developed this coziness and this feeling of safety in their room. And a lot of them have been watching the news for the last year, and a lot of them have been watching all these horror stories, and so they're just all really, really scared, understandably so. We've seen a lot of deaths in our facilities, and I mean, there's been, I think in the last year, through the whole course of COVID, about 10 to 12 people died at my dad's facility. It went through in 2 different waves. They lost 5 or 6, and then they all got past it. And then before the vaccinations got there, and it hit again. And so it's a valid fear, but now what, And so not dismissing it, not belittling them because of it, and really understanding that their fears are extremely valid, and what has happened is a real thing, and giving them that grace to slowly, realize that it's okay.
Well, I'm going to say we only have 2 minutes to 12, so probably about time to wrap it up. And hopefully everyone's got a chance to ask their questions or provide comments. Certainly, here's Regina's contact information for her business. And if you have any follow-up questions or ideas after our event today, I'm sure she'd be happy to chat with you. And you're also welcome to reach out to us. So thanks again for joining us. And I hope everybody has a good rest of their Thursday.
Thank you.
Thank you.
Thanks, Regina.
You're
Thanks,
welcome.